This is a thermoluminescent dosimetry badge. It should always be worn anytime you're in an x-ray room, anywhere in the vicinity of taking an x-ray. It helps us determine how much we're being exposed to the radiation. It should always be worn at the thyroid collar and outside of the apron and outside of the collar, so that way it can basically detect how much radiation you're getting. It is turned in quarterly, and it is measured mostly by, well, first there's a light-proof envelope around the inside, and then it's measured by the amount of light emitting from a crystal that's inside the detector. It's important to keep these away from the sun, because obviously the sun creates the radiation. There is a maximum permissible dose, so that dose is actually 5,000 milligrams per year. And the way, when we get our reports back, it helps us see where we're at and how much we've been exposed, and it keeps track of it annually. And then you can always go back and look at how much you've been exposed in the past and how long you've been wearing it for in a certain time period as well. So let me show you an example of that. So here I'm going to find myself on this quarterly dosimetry report. So here's my name, Marissa Aguilera. Wear period, so October 5th, 2018 to January 4th. It is worn at the chest, and notice how it says ND all the way across. So it's not detectable, meaning I'm way below the maximum permissible dose. It doesn't even record it at all. Personal protective equipment. There is multiple things that you can wear to protect yourself from all the radiation. So first you can start off with a thyroid collar, so it goes around here. Before you put it on, it's always good to take a look at it, make sure there's no tears, no cracks. Also, every 6 months we go ahead and x-ray all of our equipment, because you know, it may look good on the outside, but on the inside the lead could be cracked, so then that would defeat the purpose of the protection of it. Let's see, you can also wear your lead-lined gloves, and these are super important, especially when holding on to the legs of a patient. If you're holding them manually, and if they're not sedated, you know, you gotta make sure they're still for that x-ray shot. Never put your glove under the primary beam, which is where the light is on, because it doesn't protect you from that radiation. It only protects you from any scatter radiation. So always make sure it's on the primary beam. You can also wear an apron. So this is the main thing, because it protects your whole body from the rest of it. You just Velcro it in the back and then tie it up. Also make sure and visualize, make sure there's no tears, no cracks, no damage to it in general, because like I said before, it would defeat the purpose of the protection. With your thyroid collar, you're just going to put it right here, and then of course you'll put your gloves on later, right before you take your x-ray. Last but not least, you'll also put on your dosimetry badge right here. Never cover it, because it wouldn't be able to detect the exposure of radiation at that time. So, there are 3 methods of restraint used in radiology. So there is manual, there's non-manual, and chemical. So what are they? Manual is exactly what you're doing. So you're actually physically holding on to the patient. You're extending their limbs, your hands are there, close by to the beam, but out of the primary beam. Also non-manual, you don't have to necessarily be holding on to the patient themselves, but you're using, you know, some gauze, so that way you can extend their limbs. You don't have to hold on to the patient's legs themselves, but this will help you pull them back. There is also chemical. So what that means is a patient is sedated with some, you know, either Targesic or Tilazol, whatever it may be. That way they're still they're sturdy, so that way you can properly take your x-ray. Some things that can help you position them, you can use a V-trough, so that way the patient can go right in here and they're not moving around or anything. It keeps them nice and sturdy. Also, it comes really helpful when it comes to small dogs. You don't want, they're so small that you don't want your hands in the way. And also with like deep chested dogs as well, you don't want them moving around. It's hard to keep them still. Same with sandbags. You can put them on the side of the patient, keep them from moving around, or even on any of their limbs. So that way you can get the perfect x-ray on the first try. And the gauze, as mentioned earlier, wrap them around any of their limbs, and it'll help you pull them away as need be. It's always important to take an x-ray, get it perfect on the first shot. Those positioning aids will definitely help you get it on the first try. You don't want to continuously do retakes because that creates more exposure, not only for the patient, for you, and everybody around. You don't want that happening. So those positioning aids come out. They're super helpful for you, so that way you can do it as quickly as possible. Also, the exposure, you want it as low as reasonably achievable. And that's what ALARA stands for. You never want anything in the primary beam because that is where the most exposure is at. Even if you have any of your protection, your gloves, or anything on, doesn't necessarily protect you from that primary beam. It only protects you from any of the scatter radiation. Anybody that is pregnant or under the age of 18 is not allowed within the x-ray room. Reason being, pregnant women, it can affect the fetus, and that affects the growth of the child or potential child even. Also, when it comes to people under the age of 18, they're still growing, so it can affect their cells for growth. It can stop them, especially when there's a lot of exposure for them. So that's why it's super important to also just take it on the first try, because anybody that could be under the age of 18 around, they may not be necessarily doing the x-ray, but they could be within the vicinity, and so you don't want to expose them. We're going to be taking an x-ray of craniocaudal radius ulna, and this is Jake over here. So I'm going to go here and measure what we need so we can get that view. So I'm going to get his forelimb here. We're going to measure. It comes down to about 3. Yeah, so 3 centimeters. So we're going to make sure it's tabletop. If it is less than 10 centimeters, has to be a tabletop. So that's adjusted. We're going to go over here to the technique guide. Look for extremity. It'll ask you whether it's on the grid or not. So since it's no grid, we're going to go on over to 3. So we need to set it at 3.3 and 50. So I'm going to go back over here and change this. Perfect. Alright, so we've measured everything. Now I need to put his information in the system. So here we have Jake Sanderson. And whenever Allison's here to help me position him so we can put him exactly where we need to take the x-ray. Since it is tabletop, we're going to put the cassette on top here. And
Should we have a light?
yes, please. So we're really going to have to extend his leg out so that way we can get perfectly all the radius and ulna in there. I have to collimate quite a bit so we can get only what we need. We don't want to expose the pet even more than what we need to. So, and I'm going to grab some gauze to help me keep his... if in case Jake starts to move, this will help me keep it straight, nice and straight, exactly in the position that I need to get that perfect x-ray on the first shot. You want to do it as quickly as possible and on the first try as well. And you want to center it basically mid-shaft of the radius ulna. And I'll put my glove on and I'll hold it over here. Allison already has her gloves on. We have all our protective gear on. So everything's set up to where I would need it, and this is where I would take it, but since Tammy has no gear on, I'm gonna have her step out the room really quick, and then she'll come back in. Sorry, so now I'm going to take the cassette. You see here, I can't really zoom in on this system, but I'm going to go ahead and send it over to the computer here, and then we can bring it up more, and then we can zoom in and get all our information on there. So let's send it over. And there it is, opened up, and then from here the doctor can zoom in on whatever they need to look at to get a proper diagnosis. And all the information for the patients on the top corners. So Jake Sackerson, 2 years old, date of birth, what view you're in. Also over here is our animal clinic name, the date and time, and there's our radius ulna. We're going to be doing a VD thorax on Jake today. So first I'm going to go ahead and go measure so that way we can go on our technique chart and see exactly what we need to put the settings at for the x-ray machine. So we'll measure the thickest part of his chest, which is most likely the caudal aspect of the ribs. So we'll go ahead and try to measure him. Make sure. So that's about 10 centimeters. So we'll come over here to our technique chart. And for the chest, including the ribs, it's at 5.0, and we'll bring it on over to the 10, and it'll be 68 for the KBP. So 5.0 and 68. This. Since it was 10 centimeters, we can go ahead and move it down to film tray, since he's right on edge, and make sure that's good. We'll get our cassette here. He's a small cat, so we can go ahead and use a smaller cassette. Place it into the tray, and this will be his right side. We'll put the marker there. Before we take our x-ray, we'll go ahead and put his information in. The numbers are correct and exactly what they need to be for the technique guide. And now we'll prop him up to get him ready to take an x-ray. This is where I would take the x-ray, so I'll have Tammy step out the room. Okay, we just finished taking the x-ray. Tammy came back in. So I'll take this cassette, come over to make sure all the hair is off. That's right, on the VD thorax. Put it in there, load. Okay, awesome. So here's our VD thorax. We can see the whole chest in there. There's our marker as well. We'll send it over to our computer now. You can refresh this. And here it is at the top. Double click on it. And there is our VD thorax. And now our doctor will come in and take a look at it and see if she has a diagnosis. All the information is there: name, the age, date of birth, the position, the clinic's name, and there's our VD thorax. I'm going to demonstrate how to do OFA quality of the pelvis and also the patellas, basically the whole hip area. So basically what we're going to do first is I'm going to get a measurement, and you're going to want to measure, the thickest part. So what we'll do is measure her pubic bone. That'll be the thickest area. So I'm getting around 12 centimeters. We'll go over here to this technique guide. And here you'll have the pelvis. It'll be at 5.0, and the KVP, go over to the 12, and it'll be at 86. So 5.0 and 86. So we'll go over here now and adjust this. Colin made it really quick, approximately to where you need it. Alright, center is going to be midline, but we're also going to make sure her patellas are in. So basically what we'll be doing, we're going to turn off the light. And we have her in a V trough to help keep her steady and straight and keep her whole body leveled as well. So this part can be pretty tough. Oh man. We're going to get her whole hip in there, and we're also going to get her legs. So for the OFA quality, we're going to have to twist in to where the patellas are facing straight up, and they also need to be parallel to each other and lined up with the rest of her body to make a parallel line. So if I were about to take it, I would take it. That is where I would take the shot. But so it came out a little bit darker, so we would most likely have to readjust on the computer. But we're gonna go ahead and send it over. We're gonna pull it up into our system here on the computer. Just refresh and it will pop up soon. Usually it pops up right at the top since it is the most recent one done. Sometimes it will take a while, especially if you did have the system open already. There we go. So we only took one x-ray, so that's the only one there. And as you can see here, here is our marker on here. There's the patient's information, date of birth, their age, also which view you're doing. You're also, you also have the clinic's name and the date and time stamp. And here is our x-ray. Okay, so we're going to be doing a contrast study on Uno today. He loves to eat hair ties, so we're going to see if he has any stuck within his GI tract. So we're going to be doing an upper GI study, meaning we're going to give him some barium, which is 60% weight to volume, and also it has a high atomic number, and it is insoluble. Depending on what study is needed, that's how you decide which contrast is needed for the study, but since we're doing upper GI, we're going to give barium today. So it's 5 mL per kg, and he needs 25 mL, so we're going to give it to him little by little.
Baby. Oh.
Good job.
Poor sweetheart.
Okay, so let me wipe off any of this that fell down the side of his mouth, because it can show up on the study. Alright.
Oh, his nose.
No.
Oh, you're gonna be so mad.
Okay, so we're gonna go ahead and get it on the 0 minute mark. We're gonna do a lateral. And we've got everything pre-measured and set up. So I'm gonna turn off the light over here.
Oh, I know.
And for these studies, you cannot sedate them, only because it can affect the motility within the GI tract. So we're gonna go ahead and take this right away. We're gonna get our right lateral. So Casey, I'll have you step out. Whoa. Okay, so we just finished taking the first x-ray and we put them away. So I'm gonna upload this one real quick into the digital. So you can see all of the barium right here that was just given to him. So we cannot label it here right now, saying which side it is and how the minute mark it's at. But once the whole study is done, we'll be able to transfer it over there and we'll put the rest of the information. But for now, we'll wait for 15 minutes and then we'll take that second one and then we'll do the rest of the study. Okay, so we've waited 15 minutes now, so we're gonna go ahead and do our second x-ray. And we're gonna do a right lateral again.
Come here, baby.
Really quick, and we'll take our second x-ray. Okay, so we took our second x-ray, so now I'm gonna upload that one into our system. Of course, here was our 0 minute one, and this one is our 15 minute one, so it didn't really move much. But as you continue to take throughout the series, which every 15 minutes, so I would take another one again at 30 minute mark, we would take another one at 60 minute mark, and see where it keeps going and if it does eventually process through his GI tract. If it weren't to process through, that would mean he has a foreign body somewhere, he's blocked or something, an obstruction possibly. But once all this is done, we would send it over to the computer system. We would mark it with 0 minutes, 15 minutes, and continuously mark all of the study. And then we would see if we need to go into surgery or not, but that's how you do a contrast study. I'm going to show you how to retrieve a patient's file for x-ray viewing. So we'll click on Genesis, let it load. We'll type in our password to get in. Then it will bring up the work list. So you can do the patient ID, the sex of the patient, and the patient's name. So let's say we're looking for a patient named Coco. We'll do a female. We'll do Coco. If you enter the last name, it won't show up, just the first name. Hit search. So I need Coco Aguilera. And then here, that one was most likely a bad take on the first one. But then here are the rest of their x-rays. You can scroll through on these arrows of all the x-rays that were taken during that time frame. It's labeled with all their information. If you need to add markers, so for here, for example, there's no markers added. You can do text. Make a big box, and we'll type the letter R. There we go. And then we can move this around, place it wherever you'd like. So all our information that's needed is on there. You're going to hit File, Save, so that way it'll save any changes that you've made to it, such as the R, for labeling that it's the right lateral view. And then that way when we close it and come back to it, it will be on there. And that's how you retrieve a patient's file and make any changes if needed.
Hi, my name is Dr. Karen Smearmall, and I'm Marissa Aguilera's preceptor for her veterinary technician program at Sanford Oaks Animal Clinic. And I'm making this video after watching her video of her radiology skills. I've definitely seen an improvement as always throughout the whole program. It's been excellent. Marissa growing in understanding, in knowledge, in confidence, skills, all of it, and especially in radiology. On the video, you can see that she's very thorough, that she's never rushed, that she's careful to do each part in order. And also there's a concern for safety, specifically where she's checking in to see if everybody in the room has their shields on, and when they're not, always asking them to leave the room. And from the beginning to end, she was always in her appropriate gear as everybody else who was in the way of in doing the x-rays. And comments on using the collimator using the collimator on the cat. The collimator was a little distance from the cat's arm, especially on those measurements that can tweak it a little bit. So just recommending the collimator to always be pressed against the body where you're measuring, and that happened in all the other cases, just on that limb. And I'd do a little bit more collimating on the cat. Maybe it was on the contrast study, a little extra collimating there. And at one point, it maybe didn't happen in actuality, but the video seemed to show that Marissa walked away from a sedate patient on the table, but then it was corrected later. When she walked away, she asked an assistant to put her hand on the animal as she walked away, the animal that was in the tray under sedation. And I think that's everything. Overall, again, very good knowledge, skills, and understanding that keeps on improving.